Good afternoon, everybody. Thank you for joining us today. I am County Manager Dena Diorio. We have several items to update you on this afternoon, and joining me today is CMPD Deputy Chief Jeff Estes and Public Health Director Gibbie Harris. I want to thank Rick Hafner, who is providing our sign language services today. We have now been in the Governor's Stay Safer at Home Phase 2.5 order for 3 weeks. This has allowed more businesses to open with certain restrictions, more people to gather for special occasions, and generally recognizes the hard work everyone around here across the state have been doing to wear their masks, social distance, and wash their hands. That resolve has resulted in our numbers stabilizing and going down. I want to thank the community for this tremendous effort. In addition, earlier this week, the governor announced that venues with 10,000 or more capacity can begin to let 7% of that capacity attend those venues, and this will allow the Panthers to have fans in attendance at their next home game. CMS has also announced that they will begin bringing younger children and those with special needs back to school in a few weeks, as has UNC Charlotte. These reopenings would not be possible without the hard work and dedication this community continues to show to stay safe. And as we continue to reopen, I ask that you continue these efforts and not let your guard down. As proof of how dedicated this community is to staying safe, I am pleased to announce that our 2 million mask initiative is getting closer to reaching its goal. To date, more than 1.8 million masks have been distributed in this region, and only about 150,000 masks remain. If you still need a mask, if you want them for your company or a business that may be considering bringing people back to work, please go to the link on our website at mecnc.gov and request them. If we need more, we have them available, and we'll make sure that we make them available to our community. I can also report to you that the first 2 meetings of the Board of County Commissioners COVID-19 Recovery and Renewal Task Force have taken place. I want to thank the members of the task force who will be working over the next several months to help plot Mecklenburg County's eventual recovery from the pandemic. The task force is charged with helping us emerge from the pandemic stronger and more capable of helping those who continue to suffer the most. Finally, I was pleased to learn that a federal judge has extended the deadline to fill out the census until October 31st. While that ruling may be challenged, the Census Bureau is moving forward with the extension and allows people to continue to fill out their census questionnaire online, and enumerators will continue to do their work in the field. So again, I want to strongly encourage you to fill out your form if you have not done so. The funding that North Carolina and Mecklenburg County receives from the federal government is directly tied to our census count. Currently, Mecklenburg County's response rate is at about 68%, but I'm confident with a strong final push and now hopefully another month, we can exceed the 2010 response rate of 69%. So please go to get that completed at my2020census.gov. I would now like to bring Deputy Chief Jeff Estes to provide an update on enforcement. Thank you.
Thank you. As the manager stated, so far in 2.5, we have seen a continuation of what we saw in phase 2 of compliance. So far on the restrictions, for the alcohol restrictions, we visited somewhere between 12 and 1,300 locations. We've issued multiple citations, given multiple warnings, given all sorts of education. We have also submitted several violations and complaints to the State ABC Commission. We've not received favorable results for them. In fact, we've gotten no results at all from the ABC Commission at the state over COVID violation establishments that to us were pretty clear cut. However, that's not stopping us from aggressively enforcing those who seek to operate outside the bounds of what is a lawful order by the governor of this state. Throughout that, we continue to work on educating our community members for questions that they have about who can open and where and when. We get questions about churches a good bit who are continuing to do their part in ensuring that we get 2.5 to continue on, and then hopefully into phase 3 shortly. So Despite all the challenges that we've seen as a community, and with CMPD in particular, of all things that we are responsible for, COVID has, as it has for the last, I guess, 6 months or so, remained at one of our key core responsibilities, and we remain committed to enforce anything and everything that is our responsibility. I'd now like to bring up Ms. Gibbie Harris, our Public Health Director.
Good afternoon. A quick data update. Our case count as of noon today is 28,324 cases since March. Deaths are at 350. Our cases per 100,000 are 45. That's a 7-day average, which puts us in that yellow zone that we're watching. Our percent positivity rate is at 5.2%, and that's a 7-day average as well, which also is within the yellow zone. We are averaging about 3,200 tests a day now, so the number of tests being conducted at this point has gone up a little bit since last week, which is good news. I've got several items that I'd like to speak about. One is the issue of antigen test results reporting. So starting today, the North Carolina Department of Health and Human Services will begin reporting antigen tests results as probable for COVID-19 cases. If you'll remember, we previously talked about antigen tests being less sensitive than the confirmatory PCR tests, and they are most sensitive when patients are experiencing symptoms. Based on national guidance and consistent with how other communicable diseases are reported and handled, these antigen test results will be classified differently in the state moving forward. So we will begin reporting these numbers separately as well. You will be seeing PCR tests results as well as antigen test results. What I want to emphasize, though, is this has little implications for our immediate response. Those positive test results quite often are recommended to be followed up with a PCR test to assure that there's actually a positive situation for the individual, but that doesn't happen very often at all. And so we continue to expect to treat these test results as positive tests. We continue to contact trace as well as to isolate and quarantine as if they were a confirmed PCR positive test. So the main reason for bringing this up is just to let you know that the reporting of testing data will look a little bit different moving forward. I want to address the CDC Morbidity and Mortality Weekly Report that came out that included information on contact tracing from Mecklenburg County. You've probably seen some of this in the news. What I want to say is that our department is proud of the collaborative work that we completed with CDC's contact tracing assessment team. This was not, I repeat, not an audit or an investigation of any sort. It was a collaborative assessment between federal, state, and local public health partners to determine what was happening on the ground. We were not surprised by the findings, but it helped us quantify some of the successes as well as the opportunities we have in our COVID-19 response. Some key points from that report. Our health department has attempted to contact, in the time frame of this report, over 8,000 residents with lab-confirmed COVID-19 test results. We successfully completed case investigations in almost 80% of those cases. Of those that we were able to contact, roughly half of them named and provided contact information for at least one close contact. We continued to see a number of individuals who had no close contacts or refused to provide names and information to us on those contacts. We successfully contacted households representing over 10,000 close contacts, or 75% of those reported. This assessment was conducted during a period when Mecklenburg County was experiencing our highest case rate, and the testing demand had overwhelmed the system, many test results coming back in 7 to 14 days, some coming back as late as 39 days after the test was completed. This made it difficult for us to contact those individuals, as well as not necessarily where we wanted to place our emphasis. If it had been more than 14 days since the positive test result, when the test result came to us, that individual was already out of the isolation period or the quarantine period. We, at that point in time, were attempting to contact all reported cases within 48 hours. As we've been able to slow the spread of the virus in our community and increase our testing capacity, as well as stabilize turnaround times and increasing our staffing at the health department, we are now receiving test results for greater than 95% of cases within 24 to 48 hours. And we are attempting for case investigation to happen in less than 24 hours, and that's being accomplished for nearly all our cases. A couple of more points about this. Similar data is not widely available at the local level across this country. That's one of the reasons they came to Mecklenburg County, is because we had a system in place that allowed them to pull data and analyze the situation. What we have found is that our findings are comparable to studies that were conducted in Maryland and New Jersey. Despite aggressive efforts, many in our community are reluctant to be responsive to our outreach or to provide contacts. We need all of our partners, including the media, to reinforce how important it is to cooperate with and not obstruct or undermine this process as we work to continue to slow the virus in our community. A quick update on our ambassador work. We have a new reporting system in place that will provide more data as we move forward. But at this point in this past week, we have had 95 service requests. We'll be able to break down where those requests came from for us to follow up as this system rolls out. We've had 157 visits completed. Our ambassadors will be out this weekend conducting surveillance. The staff plan to visit public Oktoberfest celebrations along with other potential hotspots. We've added 2 additional ambassadors who will join the team in the next couple of weeks. Just a quick update on schools. We have seen our first cluster in a K through 12 school. It is a private school in our community. They have had 6 cases with a combination of students and teachers, and that classroom is now being fully quarantined. All children and teachers in the classroom. One other challenge we're starting to see in the people that we're contacting who are positive, as well as in contacts from those people, is that a number of places of worship are not complying with mask wearing and social distancing. We encourage these organizations to help us in our community as we slow the spread. But we're encouraging individuals who have attended these services or any other gathering in our community to be tested. If we discover there's an immediate exposure at any of these locations, we'll be sure to notify you. So what I need to emphasize, as always, is we need everyone to do the following. Comply with the 3 W's: wearing your mask, washing your hands, and waiting 6 feet apart, to avoid gatherings, and to get your flu shot. And we'll be happy to take questions at this point.
Gibbie, it's Allison Kozmich from the Charlotte Observer. Could you give us more information about that cluster through contact tracing? Do you know yet if the virus was picked up at the school or if they brought it in, and if all other health protocols were being followed as far as social distancing and mask wearing at the school?
What we're seeing in these situations, I mean, we've had other cases in other schools, but this was the first one that rose to the cluster level. What we're seeing is that most of the cases are coming from outside exposures, not in the school setting. Our schools have been doing a fairly good job with the masking and with the social distancing. What these initial clusters have given us an opportunity to do is to help them dust off their plans and make sure they're implementing them the way they need to. But at this point, most of what we're seeing are outside exposures that get brought into the school.
Hey, Gibbie, this is David Hodges with WBTV. Thank you for your time. I had a couple questions about the text message situation from a couple weeks ago regarding health space. First, I wanted to ask why the county originally called it a scam as opposed to a glitch in the software system.
So this happened very quickly on early one morning, and what we saw is that we were learning very quickly that these had gone out, and unfortunately at the same time, most of our county systems were down. So we did not know exactly what the situation was, and we had to treat it very carefully to make sure that it was not something that the entire county needed to be aware of. As soon as we understood that it was a glitch in the software program, we were able to get that information out. We just did, the information that went out from public information was extreme caution and wanting to make sure that we were handling the situation appropriately.
I just have one more question on that. The county has also emphasized on numerous occasions that no personal information was shared or compromised in this glitch. However, the letter that was sent to commissioners from HealthSpace really did not address that. So in what way did this tech company promise that no information had been compromised, and how can you guarantee that to residents?
So I'll say a couple of things about that. All of the citizens that received the messages were legitimately in the system. So there were not any random people that were pulled in to receive these messages. They had all been entered at some point in time during COVID by the health department staff, whether they were positive at some point in time or a contact or just someone we needed to have conversation with. So the other thing is that there was no data included specifically in the text messages or in if anybody did happen to go to the site that was in the message, there was no personal information that was asked for on that site. So we feel very comfortable that there was no personal information shared. The other thing that I will say is there have been several things put in place by the system. Since then, for any future maintenance or updates, they have a 3-tiered code review process in place now. Because the health department does not contemplate ever using the alerting feature for test result notification, they have disabled all text and email capacity in that portion of the system. The language that was included in the text and emails was deleted from the system completely, and all messages for other functions that the health department does not rely heavily on has been reviewed for form and content by both the department and HealthSpace. We have an entire team that works with them on this system, and they are very comfortable now that they have that HealthSpace has put the things in place that they need to prevent this from happening again.
Hi, Gibbie. This is Hannah Smoot with The Observer. Have you come to a determination with the Panthers on exactly how many fans will be allowed in on the next home game? And along with that, will tailgating be allowed?
We continue to have conversations regularly with the Panthers as they move forward with this. We want to make sure as much as possible, obviously, that this is a safe situation for our community, and they want to make sure that it's successful. So we're working very closely on that. Tailgating will not be allowed on the Panther property. And that's what and the individuals that are coming to the game are being asked not to tailgate. I do know that they have a number. I'm not sure exactly what that is. They're not sure how many people are actually going to access tickets, but they have a whole process in place for that. That number will definitely not exceed the 7% that the state has allowed.
Is the county okay with going up to that 7% number? Is that what you're leaning to?
I believe that with the plans they have in place, we've been working with them for several months on these plans, that if they are enforced properly, that there will be a safe opportunity for our community to enjoy the game.
Gibbie, it's Allison again from the Charlotte Observer. Can you talk about any new cases you've learned about from the Republican National Convention, whether that's staff in Charlotte or delegates, any new cases you can report, and a status on when we can expect to see that after action report from the RNC?
We have been working to be in touch with the RNC committee on both of those things. We have not received a follow-up report on this. I will let you know as soon as I have more information, but we have not gotten any additional information on positives, nor do we know what their process is going to be about the after-action report. So we are following up on that, and we'll let you know as soon as we know.
Gibbie, this is Katie Peralta with the Charlotte Agenda. How can you rate the effectiveness of the ambassador program thus far as it relates to communication with and education of local businesses?
We've actually had very good response for the businesses that we've been involved with up to this point. The ambassadors are skilled in having conversations in a way that's not confrontational and is educational and supportive. We walk into these situations wanting to make the businesses as successful as possible and making sure that they have what they need and are doing what they need to do to make sure their patrons are safe. So most have been very welcoming and appreciative of the information. And when we find one that is not doing what they need to do, we follow up after a week to make sure that they're able to comply at that point.
Hi, it's Tony Messia with the Charlotte Ledger. My question is about the public schools. Can you clarify what advice you gave to CMS about reopening schools? Because the chair of the school board was quoted in the Observer the other day saying that you had advised them not to reopen schools until reopening metrics were met, which haven't been met. Can you just clarify what you've told CMS and what you recommended to CMS publicly or privately?
So we've done a couple of things. We worked with them on all the metrics, but the ones that obviously we provided were the public health metrics. And as I mentioned earlier, those metrics are in the yellow zone, which does not restrict the schools from opening again. As they continue to decrease in our community, support the idea that some in-class instruction is probably a good idea. As I've said before, a couple of metrics, one metric is not enough to make a decision on, and so we worked with them on those broad metrics that they have in place, and the school continues to look at those. We had some conversation with them this morning, and almost all of those are in the green now. There are a couple that they're still gathering information on. So at this point, we're comfortable with the plans the schools have put in place. We're comfortable with the training that they've made available to teachers. And as with all of our plans, it's all about the implementation. So we're supportive of in-class instruction at some level within our community, and we'll continue to work with the schools to make sure that we're addressing any issues that come up as they move back into the classrooms. Well, we thank you for your time this morning and appreciate your... Oops.
I'm sorry to interrupt. Okay, I just wanted to wait until the end. I actually just have a question. My name is Sharon Hayes, sorry, with WBTV News. I have a question for County Manager Dena Diorio, specifically about the housing instability and homelessness report that was released to us. And I wondered if you could give me a quick response on some of the findings from that.
Well, thank you for asking that question. I mean, I don't think anybody's really surprised by what we saw in that report. The amount of rent that people are able to pay and the rents in our community continue to go in a divergent direction. But I think you know that the county, as well as the city, as well as others, are very committed to doing what we can to advance affordable housing projects in this community. We're working on several that will help to preserve naturally occurring affordable housing, working on some creative rental subsidy programs for people. But, you know, it's something that we've known about for a long time, and the challenges continue to persist. So we're going to continue to work as hard as we can to try to narrow the gap between what rents are and what people are have the ability to pay. Thank you, everybody. We appreciate you being here. Have a wonderful weekend. Thank you.